Hi everyone. I think everybody's drained with a lot of talks and a lot of jargons around AI, healthcare, longevity. So let's keep it light, right? What we'll do is I'll moderate, but I want the audience to also ask questions. I think most of them are sleepy probably. Right? So let's reignite some of the energy back, right? But before I start, I would want all of you, each of you, to kind of give a more practical aspect of what you have been kind of hearing the whole day, right? We'll start with Dr. Garg.
Yes. So I just asked see, Ayurveda is looked from the prism of drugs or herbs, but it's a science to understand the disease better. If I don't know what is causing diabetes, how many pills or drugs or herbs I put in the body, nothing going to work. Similarly, functional medicine, also more of a science-based, recent database approach, which allows us to understand what's going wrong in diabetes, hypothyroidism, psoriasis, things like that. We are able to plan what is going wrong. Then we can bring lifestyle, we can bring circadian biology, we can bring herbs, we can bring nutraceuticals, we can bring pharmaceuticals to solve the problem. So it is important that we understand the problem better. We keep talking about solutions, we keep talking about all fancy things, AI, things like that, but we don't even know what is causing the problem. Where is the problem? So I think getting to the root cause is very, very important.
Okay, good. Dr. Saini, what's your take?
I'll be very honest here. So I've not heard most of the talk. So I'll be very honest. But let's give a small take on this. So there's an interesting title which is Connecting Health for Longevity. Now, when you say connecting, what are we connecting? Are we connecting various aspects of technology? Are we connecting various organs of our body? And the fundamental aspect is we, as a human being, is a collection of more than our organs. So that means we have to first understand that we cannot take signatures from one part and try to understand our health. So while we talk about all the tools and devices and AI and intervention approaches, we must understand that our body is a well-synchronized organs system. And we must try to understand that. I rather talk about whole body, and that's one very important part of our health. And I think that is where the narrative of future should go to understand the whole body as a whole.
Well, what's your take?
From our perspective, just to give a quick one-liner about Podia, we do the home care for patients across the country in their comfort of their homes, and a big part of that, of course, is elder care. Almost 70% of our patients are elderly, and in this I say 65 plus and not necessarily 60 plus. And as we have built this business over the last 12 years and have supported over 1.5 million patients so far, of course, anything which you can take to the market and do, and I just commented it from a business perspective, but end of the day, your target segment customer should be willing to pay for the technology and for the usage, right? So of course, connected devices, the AI now, a lot of other analytics, those pieces which are coming into play are very, very useful, right? There are 2 or 3 things which you have to look at. One, you have to look at saying that, is your target segment, customer segment, willing to pay for it? How do you price it, right? I mean, I can value add, but the value add should be seen by the customer and should be willing to pay for it. I think that's one thing which becomes very critical. Second, all the technology which you are using can help you basically in 2 ways. It can either help you to increase the efficiency, which the country of India's scale needs actually. I mean, we always talk about number of doctors per 1,000 patients and things like that, right? So that number of paramedical staff, right? And both of those worldwide as well as India is in a tremendous shortage. So how does the technology and AI play a role into improving efficiency? And the second thing which is important in usage of technology is that how does it improve your effectiveness? So if I start using all these devices and as I start using AI on top of it, am I really making medicine more personalized for the customers? Correct. So I think that is something where what both the co-panelists are saying, it will really help patients to basically recover faster, right? That's where the effectiveness of that will come. And all 3 have to be looked into isolation to make sure that we are using technology the right way in all 3 areas. And to my mind, that's very important to basically marry business with whatever technology we are using. I mean, pure play technology is very exciting and very great actually. But how does it help you on the ground, and who's willing to pay how much for that is very important thing to see.
I agree, like we discussed, right? When rubber meets the road, we really know how fast that car can go, right? Otherwise, it's all theory, right? Before I move, I would request the audience to come up with questions. Maybe in 5 minutes, we'll take questions. We'll keep it interactive, right? So, Dr. Garg, in your practice, when somebody, let's say a patient comes, and now patients can actually upload their blood report on GPT or Claude, and then they come up with some solution. How do you tackle that, right? We're talking about AI, so consumers are using AI, right, today. And how do you tackle, they'll come and say that this is probably the solution that I found. What do you think about the solution, and what's your take on that?
I think science is growing, data is growing, and everybody wants the right answers. So as a doctor, I should have the answers ready. If I don't, I should tell the patient, I will read about it and come back to you with the right answer. So it's a fantastic that people are becoming aware. They're using these technologies, this data to understand better about their health. And practitioners, we have to update ourselves. We cannot be using books which are written 40 years back today. It's not working. So we have to raise up to the expectation.
And do you use AI in your practice? Do you go to like GPT or Claude and basically do some reasoning and analysis?
See, any patient comes to us, we at least look at 400 markers, and we don't have a system to help us. We manually looking at and then we correlating manually to the symptoms of the patient and trying to make some sense of the data. And there are data points which we don't understand, and technically in the books the data points are saying, oh, this means this, but it might not mean the same thing in this patient. So we use whatever we can and try to attend to the daily health of the patient.
And Dr. Saini, what about research? Right? How is AI getting into longevity research that you are doing in ISC?
So let's see, the field material for AI is data. And health data is very fragmented and also not very well curated. And I think a lot of health data, we need a lot of data parameters missing when we actually file it. The second aspect in health data is, you mentioned we collect 400 data points. Now the question is, why do we need to collect 400 data points? We collect 400 data points because there are a lot of features which do not emerge on the first instance when you start talking or interacting with the individual. And that's where AI can actually come in very easily. But the point is, when you start with 400 data points, that's not a very good field material for AI. You need millions of data points. You need millions of data points of health. You need millions of data points for sickness. And you need to overlay the features to understand what features will best tell you about a potential sickness condition. And that's where AI can come in. So one of the things which we are doing, we are collecting millions of data points for healthy people. We aim to collect millions of data points for sick people. And then use AI tool. One of the main things is we do not have high quality data for Indians. Molecular data we do not have. There are projects going on, but we would like keeping in view Indians' diversity and the challenges of language, food, everything changes every 80 to 100 kilometers. We really don't think how we're going to solve the problem of enough data. Rather, we just have to keep collecting data. That's where the AI could be very useful. To identify a newer set of markers which will allow a clinician to take a decision. Then what would be the essential markers to identify something is wrong, what would be the second tier marker, identify where it is wrong, and third, we set up markers to decide what should be the therapeutic intervention.
And how are you collecting these data? Are these volunteers who are coming and working with you?
It's not working with us. India doesn't work with me. We work for India. That means the volunteers have to be sought.
Yeah.
So we go to the field, both rural, urban, or we seek out healthy people to volunteer. We reach out to people who are healthy and we actually enroll them in the study. And it's completely a voluntary exercise, but we have to keep reaching out, and that's a constant endeavor to get more data from them.
Are you recruiting volunteers?
Absolutely.
There are probably a lot of people here.
Absolutely. If you visit our website, Longevity India, you'll get to know how to enroll for this study.
And do when you come up with the analysis, right? Do the general public, like founders or other research organizations, have access to the data, the study that you have?
Is going to go to the best way to share data is give it to a government organization. So ICMR is backing it. So all the data will go to ICMR and it will be shared by a responsible sharing program.
Yeah.
You can't tell why you want the data. You cannot just say I want the data and use it. So it will be there. It will be purpose driven, and we'll have something called federated learning. So you can actually use the data for analytics. Data will not belong to you. The analytics will.
Makes sense. Great. And Vaibhav, how are are you using AI in your connected care, right? For the elders and seniors, are you using at-home devices, monitoring devices? Have you started doing that?
Yes, so we have been experimenting with using connected devices. I think that's something which has started, the work has started. Of course, traction is still taking its own time in India. Everything people want to use, don't want to pay for it. I think that's one thing which is very peculiar about us. So that's something which we are building. But as we have spent more time on this, we are seeing traction where we are seeing that patients are willing to share data and use the devices. Other thing which we are looking at saying how do we use the data, basically how do we collect data in a non-intrusive way actually. So I mean, even if I'm doing we are in patients home for 24 hours for days together, months together, all the data which we are collecting as part of their progress and comparing it to their prescriptions and progress report and so on and so forth, we are figuring out how to leverage some of those to create personalization for them. Okay, and the biggest thing is that for us as a company also, and as for us as a community also, if I have a patient who has come on board with us for all their healthcare needs, we should be supporting them. So more data I have for them of what they are likely to face, what kind of thing has improved, what has not improved, and we are seeing very good innovation in terms of for say things like physiotherapy, which was like earlier not having much AI usage. Today I'm seeing tremendous usage of devices and AI in that sense. So we are doing those basically hybrid models of physiotherapy where I can do basically assessment using AI, posture analysis, everything I can do using AI, and then of course I can create a treatment plan for them, which is hybrid in nature. So I have somebody going to their homes X number of days and doing digital physiotherapy for rest of the times, and that's something again we are seeing traction for those. Another area which we started working with a partner, we are seeing if yoga and physiotherapy can coexist actually. When we're talking about Ayurveda before this, I mean, you're looking at with technology, AI, physiotherapy, as well as the yoga, can you combine those kind of things? So a lot of experiments, I think, and we believe that is something which will change the way we look at healthcare. The personalization is something which is here to basically assess and build on. I would say that another 3 to 5 years before it becomes mainstream, but a lot of action on that.
Yeah. So basically, to summarize for the last 15 minutes, what we're talking about is that the problem with current healthcare is that we don't go to the root cause of the problem. Right? We look at more symptom management or sick care, to put it bluntly. Right? So we do that, but to actually achieve that, we need more data. And what you are working on the data, right? Once we have more data, we'll be able to do more personalization. Right? So one follow-up question, Vaibhav, when you go to these seniors and elders, what is the acceptance level of them when you tell them about do a wearable or a ring for sleep management or something for fall detection? Do they accept it, or they have some resistance and then you have to convince them?
So I think things where they see a real issue, they accept it very quickly. I mean, that's how we are, right? We are as a country also. We don't believe in prevention so much, right? I mean, that's how we have been, and that people who have been elderly, who are probably 1, 2, or 3 generations before me also, are that much more averse to using technology actually. And say, okay, let me figure out actually, that's how it is. But wherever they see a real danger or wherever they are able to see a real benefit, in both the cases they start using it. And I think that's something which has worked. For some of them it has worked. I would say that technology uses will become a lot more prevalent in the elderly. Maybe another, as I said, 3 to 5 years, because the next couple of generations will get into that area. You will see a lot more acceptance of that.
Fine, cool. Any questions from the audience? Anybody? Oh, there is one. Sure.
Thank you to all the panelists. So I come from a tech background and I'm looking for what type of solutions we can provide. Like there are a lot of variable solutions that are coming in market. So are there any regulations that we need to keep in mind while building all these, or can you touch on the regulation side that may hamper some of these solutions for longevity and connected health?
I think where we stand now, and I may stand corrected if any other experts are there, but I would say that there are no necessarily regulations for wearables today. I think acceptance of that as medical grade is something which has to basically happen from the medical fraternity, right? So I mean, you have not watches which can do ECG for you, and of course sleep and everything. But if you really have a sleep problem, you need to sleep study at home with a proper medically approved device, right? So a lot of variables are given. Some of those will get FDA approved. All those things also will happen. But I think that's still some more time to go. This being like the first thing for you to know that something is wrong is a fair thing to use. Actually, I mean, if you are having your smartwatch and your sleep scores are not coming very good, you see it over a period of time and say, okay, let me go to a doctor and see what to do about it. I think that's a fair thing. With that, can you deduce that okay, you need a sleep study and you need a CPAP machine? That you cannot do that. That you need a real expert to talk to about actually. So I would say good from preventive and understanding perspective, not necessarily from curing perspective. Not to decide whether you cure it or not.
Deepak, you want to
Yeah, so I just want to ask this question to the audience here. How many of you are wearing a smartwatch? I expect all the hands to be up because I think everybody's wearing one. How many of you have used a smartwatch for your health-based tools? Any of the tools are health-based. Look at the number, how small it has come down to. So a lot of us actually use our smartwatch to still read messages and look at time and look who's calling. So I think smart devices usage is a personal process. It starts with you. Right? A lot of what he says is if you are actually able to tell something to somebody before it becomes bad, that's where the value of these devices come from. A lot of these devices are actually not in the regulated zone right now because they are not tested to the extent a clinician will actually accept them. That gray zone still exists.
Right, sir. So I understand for smartwatches, but something like a fall detection device that's specifically built for one purpose.
Yeah, it all depends on how difficult to use the device happens to be, how cumbersome it is, how much is the compliance. A lot of things fail. I mean, our traditional medicine fail in terms of therapy and compliance level. But that's a problem. Compliance is a major issue.
Other thing is that also why do you use the device? You use anything medical for two ways. Either you can use it for yourself to see how you're doing in a preventive manner, even point of care devices, or it's doctor recommended. So that's the second one is what most of the people will go by. For a doctor to recommend this needs to have a lot more trials and medical grade approval. Not only for fall prevention actually, even if you see things which are like 3D to ECG and things like that also, acceptance by the medical fraternity in the country is still very, very nascent actually. Right? I mean, we do this Holter monitoring, right? You can do Holter monitoring with patch also. You can do Holter monitoring with a proper device also. And of course, there are very good patches which are properly approved and everything. Is acceptance very high in the market by medical fraternity? Very, very early stage. From regular traditional devices, is that acceptance is very high? That's what doctor will tell you to use actually. And if you have a real problem or you think you have a real problem, you are more likely to go by what doctor says actually. So I think that's that balance which we need to build in whatever technology we are starting or if you are looking at creating something like that. Fall prevention is a big thing actually. It's a big need. Correct? You always come to know after you have fallen, right? The fact is that if something can prevent it, nothing like that. I mean, that's something which is very important for elderly. One of the biggest reasons for hip fractures and so on and so forth. So it's a great thing to build, but of course you have to figure out how to make people start using as a preventive thing rather than doctor recommendation.
Yeah. We'll take another question. So you can go ahead. You have the mic. So basically, to summarize, we are saying that if you're building a consumer device, it's okay. There is not that much of regulation. You can build it. Can be used for preventive, early detection, understanding your body generally. Right? Like Dr. Saini said, a lot of people don't still use their watch to understand their sleep or HRV data. Right? And then if it has to be more clinically proven, if it is going for let's say like fall detection or ECG or
yes, absolutely. Yes.
Dr. Saini, you mentioned 400 as a marker they're writing, and you mentioned using AI to get new features in it. But from what I've learned from using AI, like the small amount I have, it gets lost in keywords. Like it finds keywords and then it associates things to those keywords rather than learning about the user holistically and getting to the root cause, as you mentioned again. So, could you talk about that?
After that, AI, you have to ask the right question. AI does not have all the answers. If I am looking at a disease pattern or symptoms, I am looking at the marker, I want to make sense of this marker to the context of the body. Then I ask the question whether it's something already existing in the database, which is helping me to make a better decision. AI will not give you answer. Okay, so AI does not have all the answers at this point of time. Okay? And maybe AI is more tuned to the sickness care. Preventive care, functional medicine is very new for AI also. We are also very new to this. Longevity is very new. That all data points has to be gathered, fed into the system, maybe 10 years. But today we are practicing it. So as a clinician, I have to use my mind, brain, consciousness, whatever, to come to some right answer.
That part is not replicable, right? That's what you would say. That's what it feels like. The overall understanding of.
So to understand it, we cannot put everything on technology.
Yeah.
We have to increase the capacity of the country to have very good clinicians who can practice this. Then use the AI just as a support. You cannot rely on it. And moreover, longevity health starts when you are at ease. When the doctor tells you you can heal, things can get better, then only your energy system will get better. It's not about drugs, it's not about food, etc. It's also about the energy system, which AI cannot, console you for that.
I'll just add one more thing. This is the last thing you want to play with using technology without knowing it or without this being proven. So of course this can aid you as you start. But as a patient or as a consumer, it's the last thing you will play with actually because the impact will be very far-reaching.
How many of you have heard about idiot syndrome? Do you know what it stands for? It stands for internet-derived information, obstructing treatment, obstructing thoughts, obstructing anything you can put it. Okay, you can play around with goals all this one. And that's actually a very major problem. When a person walks into a clinician and tries to tell the clinician what's wrong with them. And actually fighting with the clinician that why you're not getting the right therapy. So a lot of therapy comes by experience, where you actually understand how one symptoms, one feature aligns with the individual person. And that is something which is very difficult to treat from AI or the associations with an individual with features which you extract. So as long as natural stupidity exists, AI will not win.
Okay, that's a good one. I think we can take one more question or we're done.
Yeah,
One more question?
One more.
Okay, last. Keep it short. Oh, then
Okay, so this question's for
Short
Dr.
video.
Saini, and I'm asking you this because as an academician, you must be facing this. There's a lot of very interesting work happening in universities worldwide in biochemistry and nutrition, and we read about it as a member of the public with aging parents and sick children. So we hear about this, how we can use nutrients to improve our health. But then coming down to the real world, it never percolates down to, medicine. And right now, everybody's talking about preventive health. There's not even a passing mention of Linus Pauling or that he won 2 Nobel Prizes or orthomolecular medicine's been blacklisted, and nor William Walsh or his work on depression and schizophrenia, or, the list goes on. So
what's the question?
my question is, what do we do apart from find the medical system? I don't know.
So there's a very interesting book by Bill Bryson, which says a brief history of everything. Have you read it?
Yes, I know.
So that's a problem. That's a fundamental problem that we only read or carry information if it concerns us. I'm not interested in Linus Pauling if my knee is hurting. Why should I read about it? So I think every human being is self-centric. We only want to know what's bothering us or bothering us. There are enough channels on YouTube and your WhatsApp family groups which treats pretty much everything for you. Correct? And it happens. But we do not use those information unless we have a concept of the problem we are facing. So while there's a lot of information around us, we need to figure out how do we filter out the right information and present in a way it can be digested or ingested by a person who is a common lay person.
Thank you very much, and let's start.